Patient laying supine with shoulder abducted to about 130 degrees and externally rotated to 90. Practitioner, while standing at the head of the table, will stabilize elbow and distal humeral with one hand and other hand grasping the humeral head. Stabilizing elbow while uses one hand on humeral head to lift the humeral forward. If the patient tests positive, pain, apprehension, excessive anterior translation with test or clunky. Clunk test. While patients laying supine, practitioner will sit or stand by their head, placing one hand on their scapula under their shoulder, other hand on the humerus by the elbow. Fully abduct patient's arm and then push anteriorly with the hand. Humeral head while other hand rotates humerus into external rotation. While patient laying supine, practitioner standing on the test side will bring shoulder to about 90-90 and externally rotate. Once getting to the stopping point, push on humeral head and crank back, then release the pressure. A positive test would show apprehension on the face. Patient being seated, practitioners behind the patient, one hand stabilizing the shoulders, finger over clavicle, other hand cups deltoid and squeezes while pulling back and forth. The positive test is no pain, but patient gets apprehensive. While patient is seated, the practitioner will place shoulder at about 90-90, stabilizing at elbow and wrist. Internally abduct arm in wave-like motion. Positive test would be pain. Patient seated with 90-degree elbow flexion, ask patient to uppercut while you resist, then ask to pull into their stomach while you resist. A positive test is reproduced in the bicipital groove during the test. Patient standing or seated with arm 90-degree abducted, shoulder and elbow are in the frontal plane of the chest. Open and close hands slowly over a 3-minute period. With patient standing or seated, practitioner will palpate radial pulse on wrist, asking patient to look away from the shoulder while arm is at 90-degree abduction. A positive test would be decreased or diminished pulse. With patient seated and shoulder abducted to 30 degrees, the practitioner will palpate radial pulse on wrist, asking patient to extend neck and turn head toward testing shoulder, then take deep breath and hold it. The positive test would be marked decreased disappearance of radial pulse. With patient standing, elbow and shoulder 90-degree flexed, practitioner will ask patient to touch opposite shoulder. When they touch opposite shoulder, you're going to push the arm into further cross horizontal adduction. A positive test would be localized pain over acromioclavicular joint. Patient standing, practitioner will have patient raise arm above head and reach the opposite shoulder while trying to touch hands. Positive test would be unable to touch hands or hands are far from touching. As you can see, my patient tests positive. With patient seated, practitioner with one hand over top of shoulder while other hand grabs elbow area and pulls down a couple times. A positive test is a sulcus defined as a depression greater than a finger. Patient hand in a diamond shape and pressed against a wall. Practitioner will ask patient to protract and retract shoulder blades while you watch out for winging of the scapula. With patient standing, practitioner will ask patient to raise arms above head, then slowly lower arms back to the side. A positive test would be dropping of the arm, weakness in maintaining arm position. With patient standing, 90-degree in-front shoulder flexion, practitioner push down on forearm and instruct patient to apply an upward force. A positive test would be pain reproduction or clicking in the shoulder. A patient will be standing with shoulders in front, 90-degree flexion, palms facing upward. Practitioner will apply downward force while patient resists. With patient standing and hand on stomach, practitioner will put hand under the patient's hand and pull while they push their hand to their stomach as hard as they can. A positive test, patient would be unable to maintain pressure of examiner's hand while moving elbow forward if patient extends shoulder. With patient standing, practitioner will hold wrist and slowly raise arm up to their head with palm facing away. A positive test will be pain while externally rotated and passively flexing that position. With patient standing and arms elevated to 90-degree in scapular plane, elbows extended, the practitioner will apply a downward direction force while patient resists. A positive test would experience pain or weakness with resistance.
This is the Hawkins-Kennedy test. Your patient should be seated while you're standing, having patient shoulder at 90 degrees. You should stabilize patient's elbow and wrist, internally abducting arm in wave motion. A positive test would be pain. For the NEERS test, your patient should be standing while you have one hand over the top of the shoulder while you're standing behind or beside them. Your other hand should be holding wrist. You should slowly raise arm up to their head with palm facing away.